We get there at 6 a.m. right when the kiddos are waking up. We're kind of their rooster to get them out of bed.
We get their weights and vitals, and then from there on we move to breakfast and we provide mealtime support for them.
We sit in with them through all of those to be their support system to help redirect them behaviorally if we notice eating disorder behaviors at the tables.
We kind of just talk through what types of emotions are you feeling and how can we deal with that appropriately at the table. And then we also provide psychoeducational groups for them throughout the day just to help them ground and use the coping skills that will help them lead life in recovery.
We supervise constantly. We are the people that are there for them on the front lines.
We work until 7 p.m. at night, so it's a 12-hour shift. Specifically for a BHC, we are big on communicating effectively.
So the communication that I have with not just my BHCs as a team, but with my leadership team allows us to provide the best collaborative care for our patients.
Throughout the day, there are many changes and we have to be flexible for staff especially to be able to know where our patients are, provide that patient safety piece. And so just being in contact with the treatment team and allowing ourselves to work with whatever changes that come is necessary.
We are the ones that see the patients all the time, so we see things that their treatment teams don't see. So it's essential for us to be able to deliver that information to the clinical side and to be able to kind of establish what we see versus what they portray to their teams.
My role is crucial in helping kind of anchor that collaboration between the various disciplines, their leadership, and the BHCs.
We are essentially the home for our patients, so we really have to create that atmosphere for them to be in as therapeutic and healing as possible.
This is a very complex disorder that we're treating, and so our behavioral health counselors are constantly kept on their toes and constantly trying new things to best impact our patients' experience. Being able to be receptive to feedback and be able to integrate feedback into the work moving forward is one of the most important values or characteristics that a behavioral health counselor is required to have. We're working with human beings, and so there's a lot of gray and there's a lot of unpredictability involved. And so being able to be flexible and being able to kind of be quick on your toes and quick on your feet in the moment is a huge asset to have. The openness of experience and just being able to say, hey, you know what, I've not tried that, I don't know if I can do that, but let me give it a shot and do my best with it.
The more that you're open to flexibility and change, the more you're able to adapt to your environment better.
It is important to understand that you are the student as much as you are the teacher, and that you learn every day, and that when you think that you have learned enough, you get hit with something even more. So it's essential to be able to be open to that and to constantly be encouraged by change and be open to change.
I would say be ready to give of your skills and abilities and talents, and also being open and ready to learn new ones. We are constantly learning and growing and adapting, and not because we don't know what we do, but because our patients demand that of us. And so being able to say, hey, here's what I bring to the table, let's maximize that, as well as saying, you know what, I'm not sure how to do that, I'm not sure if I can do that, but let me go and figure it out, let me try, because I want to be a part of this team and I want to grow and learn together with the organization is something to really think about in terms of wanting to be a part of the eating recovery experience.